Hey mamas, it's your CajunStork here. I know if you're pregnant, you're probably dealing with some kind of digestive issue, whether it's constipation, heartburn, digestive issues. It's very common to deal with indigestion. And so today we're gonna talk about a couple of options for you guys that are pregnancy safe and midwife recommended. But before I begin, my name is Midwife Kira and I believe in truly natural birth because I know that it makes for better birth experiences. Consider subscribing to my channel and don't forget to join in today's conversation in the comments below. Also in the description below, you'll find a link to my pregnancy complaint kits where you're gonna find all of the products I'm gonna talk about today. So when it comes to heartburn and pregnancy, I think the #1 go-to in America is Tums. Now, in general in pregnancy, Tums are pretty safe, but believe it or not, I've actually had clients overdose on Tums in the sense that they took so many of them so frequently throughout their pregnancy that they actually ended up with kidney stones. Calcium kidney stones. And so, another thing that I've seen in pregnancy from Tums is for moms who eat excessive amounts of Tums in pregnancy, I've actually seen tiny little calcifications on the placenta after the birth. Now, it doesn't cause any harm to the pregnancy, so I don't want you guys to be alarmed, but the calcifications on the placenta is also something we see when your placenta is aging. And so it is kind of concerning to think that if you're eating an excessive amount of Tums, we might possibly be aging our placenta. We're noticing these calcifications there. And so I would like to recommend you guys to consider Tums on a small scale and maybe consider some alternative options. One of my favorite options for heartburn and indigestion in pregnancy is papaya enzymes. Now, if you are a midwife watching this, or if you Google papaya enzymes in your pregnancy, you are going to find mixed reviews on using papaya in pregnancy. I've seen articles say, absolutely, it's safe, it's definitely fine to take. I've read articles that say, no, it's definitely not safe to take. It can cause you to go into preterm labor and many other things. In my experience, both as a mom who used papaya enzymes and as a midwife who's been practicing for almost 10 years now, papaya enzymes have caused no harm to my clients during their pregnancy, has only provided tremendous benefits. But if you don't want to take the enzymes when you're pregnant, then you can definitely consider just adding papaya to a smoothie in the morning, or maybe dried papaya to eat or snack on when you're having episodes of indigestion or heartburn. And so papaya enzymes, I like these because they come with chlorophyll. You can chew them like Tums, which kind of gives you that sensation of you're actually doing something to help with your heartburn pain. But the chlorophyll adds not only a little extra flavor, it also adds a little extra iron and a little bit extra detox, a gentle detox, because you don't want to detox in general when you're pregnant, that you can take after a meal that can help with all of your symptoms that you're having. Now, besides papaya and papaya enzymes, a couple of other options that you have for heartburn and indigestion in pregnancy would be to have full fat, unflavored dairy after you're having a meal or anytime you're experiencing heartburn or upset, stomach upset. Now, you want to eat it slow. Like, I want you to picture like a full fat yogurt. You're going to eat it real slow and it's going to coat the esophagus and the lining of the stomach and help take the burning sensation out. I've had lots of moms have tremendous success by using full fat dairy for this purpose to help with heartburn and indigestion. Another tip that I give all my moms who complain of heartburn and indigestion in pregnancy is, first of all, no carbs after 3 p.m. This is rice, pasta, breads, starchy carbs, things like that. You don't want to have those things after 3 o'clock. And another thing would be to possibly just avoid them altogether, along with things like tomato sauces and other items that might cause you to have severe heartburn. However, what if you're the mom watching this and you're thinking, well, I get heartburn after I drink water. What am I supposed to do, CajunStork? Well, what you really need to be doing if you're having heartburn that severe is rebuilding the lining of your esophagus and your stomach. So I want you to definitely try the full fat dairy like I discussed and avoiding carbs after 3 p.m. But you specifically need papaya enzymes to help you break down foods, and you probably would benefit greatly from probiotics. Now, there are lots of probiotics on the market. Each of them has their own very special purpose. In pregnancy, I generally recommend the Garden of Life Vaginal Health Probiotic because it has a blend of all the probiotics that you need, not only as a pregnant woman, but just as a woman in general. to help you rebuild your flora in your gut and, believe it or not, your vagina. But you're taking them by mouth, guys. You don't have to insert vaginally, so don't let the term vaginal health probiotic mislead you. But if you're having heartburn that severely, it's time to start rebuilding, and it may even be a good time to consider switching to a Mediterranean style diet to help your body with the food digestion process. Now, there are probably many other recommendations you guys have for heartburn and indigestion that you've had success with, and if you have, I want you to post them in the comments below. But otherwise, I'll see you guys at one of my other Midwife Monday videos up here. Thanks for watching. Bye-bye.